globally, about 2 million people are diagnosed with colon cancer, and there are approximately 1 million deaths. That's about a 50%,
That's a big number.
rate.
Very big number.
It's a big number. In the US, about 150,000 people would be diagnosed and about 50,000 deaths. So it just kind of gives you an idea also that screening can prevent a lot of these deaths.
Right. So, Dr. Mehdi, again, as a common person, it becomes very, kind of surprising because cancer as a word or as a phrase is really something which scares us a lot. We hear about cancer and then we are like almost half dead after we hear this word. So, you have told us about polyps and you have told us that how they, over a long period, like 5 to 10 years, if you do not remove them, they can become cancers. But again, as a common person, how can we really stop something so serious? Is it magic or what? What is exactly the process?
Well, screening tools, and they have been effective for a number of years. So, not all cancers have screening tools available, but this is one of the most effective tools that can be used. So the first step is to identify the possibility or presence of that polyp, and that can be detected with a number of simple techniques. The simplest one that's been in use as a initial screening is to test the stool sample for traces of blood. That's been in practice for a long time. And, the screening guidelines at this time, these are in individuals who are not having any trouble, who are feeling healthy and otherwise no problems in terms of any bleeding or any change in the stool habits. For those at 45, we recommend starting screening. And the gold standard being the colonoscopy, which we will talk about in a little bit in detail. However, simple tests, especially, in globally, if those facilities are not available in rural areas or underdeveloped, or developing countries, a simple stool test, a sample can be tested with a very inexpensive kit for traces of blood. And if that is positive, then, you can make the effort of having access to a facility